growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Welcome, everyone. I'm Dr. Steve Rasner. You are watching the Lionhearted Dentist podcast. Welcome aboard. If this is your first time, thanks to everybody for continuing to have it grow. You know, we're in the middle of August, and my audience is growing rapidly. And it's weird because I really haven't changed my style, so I'm not sure exactly how that's happening. But thank you. Thank you to those of you in South Africa that seem to be growing and following me recently. And always Ireland and the UK. I should just move there. It's amazing how many downloads I have over there. But thanks. Obviously, I love you. The information I get that shows me this is reaching some of you. So I'm sorry to start every time like this, but this is why I do it. Thank you. Listen, I want to start and really focus on this podcast with something that I nudge you with often. I bother you with it. I always bring it up. You know I do. And that is just, what are you doing to change things right now? First of all, I wish I had somebody in my life that would have pushed me like a big brother, a mentor that was close. And I really try to approach you through these podcasts like that. Like a friend, even if I had never met you. I think you can tell by my tone and by my demeanor how sincere my approach is. And I wish I had had somebody, and you do. Those of you that tune in weekly, you have me. So yes, I'm nudging you because I know how easy it is to not take action. And here we are. I mean, we're into the 8th month of the year. Can you believe it? 8th month, mid-August of 2021. So here's my question. What skills have you started to train for, or are you going to train for? And maybe a better question is, which ones do I think you ought to at least consider? Obviously, I can't tell you to jump in deep real quickly with something you haven't explored. But I am going to tell you, as I've told you in little bits in other podcasts, what I would go after and why. Before I say that, I want to say one thing. Please, if any of you want to follow me on Instagram, but I talk a lot on Instagram about the things I talk about here. But this is why I'm saying this to you today. You remember me saying to you that at every motivational or management type of presentation I gave in my career, and many of them were in the first 10 of the 20-some years I've done it. I still do a few a year. I love them. I love doing them. I love talking about this. But I would always say clinical excellence is more important than any management gem I could ever give you. Like, you could probably be okay. You wouldn't be nearly as successful as you will be if you follow the principles on the Lionhearted podcast. But if you didn't even do that and you were just an amazing clinician and you were nice, you know, people would find you. Because the profession is littered with mediocrity. And I'm sorry to say that, but it's true. And I get it. It's a really hard road to carve out. You can't just get out of dental school, open an office, and be successful. And by the way, have we talked lately about what I mean when I say successful? Do you think I mean how many millions you can accumulate? I don't. What I mean, to me, success is doing what you want to do because you enjoy it, whatever that is, and working when you want to work, and not working when you don't want to work because you can afford to. You hear me, right? You know what I'm talking about, because I've been there in my career, 40 years. I've been there where, I owned one time 3 houses in my career. I bought another house before I sold my first house. And I owned that house. 2 houses. Not a shore house. And I had that too, by the way. I mean 2 regular homes. One I couldn't live in because I'm a knucklehead at that time in my life. And I had 2 mortgages. And never was a big jewelry guy, or never was even an amazing have to have this car guy. But I did some knucklehead things early in my life and in my career. And I had to make a lot of money. You don't want to be in that situation. That's why I always tell you that the common denominator that I find in successful dentists or those that lived pretty low, which is hard to do, those first 10 years. It's doable, man. But it's hard because you've been in school for your whole life. It's really hard to resist the urge to buy the house probably more than you need, the upscale house that is probably bigger and a fancier place than you need. I know, I did it. And please don't believe and talk yourself into that everybody can overcome bad decisions like I made. It's hard. And I missed a lot. I did. I missed a lot of my children growing up. And man, if I even thought about that for too long with you, I'd probably start to cry. I'm tight with my kids. I'm tight with my ex-wife. See, I'm telling you everything today. But I work too much. I think I had to. So don't make that mistake. Every laid back, easy going 50-year-old, even 40-something-year-old dentist that I know had discipline early in his career to, you do have to work a lot in the beginning, but you don't have to spend it all. It's just true. So, look, you can make a lot of money other ways. It's just not what the Lion-Hearted podcast is about. Look, there's 30 and 40-year-olds that already have 5 offices and are going to flip them to some DSO. And hell, man, that's a way. That's an avenue. I never looked at dentistry that way. I really do believe that most of you that are listening love the skill set that we can acquire as dentists and what that leads to, right? That's what this podcast is about. So naturally, your host, me, got off the track for a minute. I don't even know where I started. I do know where I started, but I don't know how I got there, where I just was. So let me back up and push you. Because I also will tell you, I know many, many other dentists that were on the verge of burnout in their career. They hated their present situation. And unless you just, for some reason, and I get it, maybe you do, hate teeth. I don't think you hate the actual services you provide or have to provide. I think you hate the situation you have gotten yourself into. A bad associateship, a lot of debt. Listen, in the best of circumstances, sometimes we choose the wrong person, right? So then there's that divorce, bad partnerships. Oh my God. We all have to overcome that stuff, and I get it. But when you can fall back on clinical excellence skill set because you invested in it. Listen, dental schools do the best they can. It's just not nearly enough. That's the absolute truth. And when you get out, it's the beginning. It's the beginning of a lifetime commitment to education. And you have to work hard to blend the investment of your time in your profession with the investment of time with life, your family, your kids. And that's a hard balance, but it is achievable. So here I go. Now I'm going to try to unbalance you by telling you what I would pursue if I was you. So I'm not going to spend a lot of time on the first couple because I don't want to sound too self-serving, because it's not my intent. But I have too many podcasts on sedation, but it leads to a better lifestyle, professional lifestyle, than any other thing I'm telling you about. So, and it's the easiest one to get. The courses are easy, and every state, and even my colleagues over there around the world, you got to check with your particular governments as to what's allowed and not allowed, because different sedation techniques require different permits. Mine is considered usually a moderate permit. And again, it's well documented on my podcast what I use. I use a combination of 4 different types of medicines, and includes nitrous, along with Benadryl. I want to talk about Benadryl in a minute. Atarax, I know they're both antihistamines. Atarax has an anti-anxiety element to it. Benadryl just makes them sleepy. And then triazolam. Look, I think it's one of the most effective combinations, hands down, in the profession. I think it's the most effective. I've tried giving Dox, and Dox is very good. Any sedation you give is going to help you. It's going to help you manage the patient. It's going to help you with your own personal skill set, executing that at a highest level, because you have a patient that's not as hard to work on. It's the truth. So go back to my old podcast for that. I wrote here next, which you always hear me say, atraumatic extractions. And that's what I meant about being self-serving. When I really started digging deep into that subject several years ago, I was going to write a book on it. Here's why. Because when I started to write articles for different periodicals about technique, I couldn't find a lot of sources or a lot of recent textbooks on it. And so, to me, it's a very underspoken part of all the other stuff that's happened to our industry in the last 20 years. I'm talking about bone grafting and implants. I mean, it starts, does it not, with getting a tooth out atraumatically. If you blow up the tooth, you blow up the bone, you just added 4 or 5 months to the process. I defy you to go out and find multiple places that you can learn this skill. But it is a skill that is learnable, and I believe you need to do it live, hands-on, and you may have to do it more than once, whether it be with me or whether you can find another avenue to learn this skill over in your country or somewhere else in the United States. I don't care. I mean, I'd obviously love to meet you. I just want you to learn the skill. And by the way, right before I talk about the other subjects, the other services I would focus on, and they are important, I would also like to tell you that when you start the pathway surgically of taking teeth out, bone grafting especially, do not get sucked into the fake stars on Instagram and Facebook. You hear me? I hope some of you are listening to me right now, because a lot of you are fake. I know it's going to make some of you mad. I know for a fact. I know there's people that get Instagram mega stardom without merit. They're good clinicians, but they act like they have been around doing this and they know everything, and it's nauseating. It used to happen on the lecture circuit too. I remember it even in cosmetics, that I would go to the AACD. I do. I remember this back in the 90s or other lectures. It's not to put the AACD down. I'm just saying an aesthetic lecture. And a guy would come out and he would show you mind-blowing before and afters. What often they failed to tell you is that A, they did the case at a discount or for free. That's why they were able to do 28 units. B, that they sent it back to the lab 9 times so that it would look good in the presentation. So it's not always real dentistry. And I'm just telling you how I believe. So don't compare yourself to others when you're on this journey of acquiring certain skills. What you do is document your results. Please remember, that's one of the most important things I've said so far in this podcast. Document your results, whether it's your endo results, which I'll talk about, your orthodontic results, etc. And that really takes diligence and time because you don't feel like doing that at the end of the day. And it's easy to skip it. And if you skip it even one day, it's really hard to remember the details. Like, what did you bone graft this socket with? Did you use what? What did you use a membrane if there was a wall of bone missing? You know, what did you put on the socket seal portion? Did you put collar plug? Did you put a collagen membrane? Did you put cytoplastic non-resorbable? Did you use PRF? You get me? You got to break it all down, and you got to be honest enough to take before and afters. You must, if you're a lion-hearted dentist for real, you have to purchase a handsome photography equipment and document everything you do. It's the beginning of becoming a master. It's just true. I know many of you are into surgery because I pushed you and you already were interested in, maybe I pushed you a little harder. But other things you absolutely have to own is a level of occlusion understanding. And it's been a long time since I've studied under anybody. I believe when I learned most of mine, it was from Dawson originally, has other mentors there. He has since passed. Pete Dawson in St. Petersburg, Florida. I know the institute still continues. It's boring to me, but it's a skill set that will undermine everything else you ever do if you don't understand occlusion. There's two different things between understanding occlusion and becoming masterful at TMJ and understanding every joint disorder, etc. I don't think you have to do that. You don't even have to treat those patients. So, Mike Melker, I believe, look him up on Facebook. Tell him I sent you. I believe he is one of many that focuses on occlusion today. Maybe Spear still does. I don't care where you go. There's another guy I want to introduce you to and tell him I sent you. I don't get anything for it except thanks, Steve. Really interesting guy named Lincoln Harris. Look him up on Facebook. He's from Australia, but he is working on a masterful online program because he believes the days of live learning are limited. Now, I offer live learning, and I think there will be a niche for that type of learning forever. I don't have a big operation. I don't have to worry about tremendous overhead or anything like that. So I can make it work, what I do. I never built the giant institute. Trust me, I'm dying to. But I never did it because I knew it would put pressure on me. But I mean, when we all used to go to live lectures, it'll come back somewhat, but I don't think it's ever going to be the way it was. And neither does he. So he put together curriculums for ranging from a few weeks, months, to years on a variety of subjects. You can write to me and I can give you more information. I don't financially gain from any of this, so please understand that. I definitely think the GP that's a lion-hearted dentist has to have some skills in endo. You want an honest disclosure? Some of you will find this laughable. I do anterior endo only. I don't do molars. Why? Because I don't have the time. I barely have the time to do anterior endo. Can't imagine you having a successful practice without that range of skills. So occlusion, endo. You know I'm a big fan of you learning surgical implant dentistry, but if you don't take it atraumatic extractions, well then that's off the table too. It is a beautiful, beautiful skill to assimilate to the daily practice. It's just unbelievable. Here's another one though, even if you don't do atraumatic extractions or implant dentistry, and that's soft tissue skills like free gingival grafts, because there's so many indications for it outside that's just a part of my regular skill set that I need. Okay, let me give examples. You have a patient coming in that's getting a denture, just a regular denture. They're not getting implants. And do you ever really study them and look at the vestibule and see how much attached gingiva you have? Do you understand how to augment the ridge with more attached gingiva? These are exciting things to incorporate. And I got to tell you, of all the grafts to learn, connective tissue graft versus free gingival grafts. Free gingival graft is a very easy graft for you to learn. You can learn it in one weekend. I've incorporated it into my teaching at my institute. But there's many places you can learn it. And I don't even think you have to do that one live hands-on. To learn to take a piece of keratinized tissue, where, how thick, and transpose that to an area that needs it. Oh my God. It's so exciting as a clinician to see the before and afters. Or around implants that have no attached gingiva, even if you didn't do the implant. I've done that many times. It's got no attached gingiva and inflammation and the beginning of the breakdown of the periodontal situation around that implant. It's a beautiful procedure to provide. I'd love to send you, if you ask me, say, Steve, send me your before and afters of what you're talking about to see if this is something I would like. I have many, many slides on it. Really what I wanted to focus on today is to give you a little bit of a kick in the butt that we're already into the 8th month. There's only 4 months left. Here's how I used to plan my courses. I want you to hear me, and then I'm going to end this. I would put a calendar out. I still do this because you have to. If you're really an educational buff, you have to put in front of you a calendar for the next 12 months. Because what will happen if you do it in your head is you'll find out a month before the course that it interferes with something very important in your life. So you get a calendar of 12 months. You put all the important things in there. The anniversary of your wife, your kids' birthdays, the family trips you're planning. And then you look and see where you can put the CE. What I used to do is plan a major 2 to 3 day curriculum, like my course. I did it every 3 to 4 months. More, probably. I did 300 hours a year. I did that for, I would say, at least 14 years. And it changes you, man. There I go with the man thing. It changes you. The people you meet are like-minded like you. You're not going to find at an advanced CE course, likely, a fellow colleague who's talking about putting together a string of 8 offices that he's going to flip to a DSO. And God bless that guy. He's entitled to do that. You can do that. It's legal. You can do it. But was never my thing. You want to make real giant money, do that. You can make great money as a dentist, but not that kind of money. 7, 8 offices, flip them to a DSO. No. It depends what you want. If you're tuned into me, I hope you want both. A good living, you can afford to do just about anything you want to do. Maybe you're not driving a Bentley. Maybe you don't have 3 homes. I don't know. But you really are proud of what you do each day. Your patients love you. Your community loves you. And you're proud of it. Anyway, that's all I got this week. Please give me feedback. I actually have a blog that's more detailed on exactly what courses I would take. I don't know if I even like it anymore. It's all the court places I used to go. And some of them have changed. Hang in there. Come on, man. Now's the time to do something. Right now. Plan it. Get that calendar out and plan the next 12 months right now. See you next week on A Lion-Hearted Dentist.